Hi there. Good afternoon. Once again, Dr. Krish Bab here. Today I am talking about the largest vein in the body. Yeah, you guessed it right. The inferior vena cava, also called as the IVC here afterwards. It is situated in the retroperitoneum, deepest structure of the abdomen. The IVC receives blood from both the lower limbs, and most of the retroperitoneal structures ascends all the way up, pierces the diaphragm, and enters into the heart at the posterior aspect of the right atrium. It is formed at the confluence of the iliac veins at the level of L5 vertebra and is situated on the right side of the vertebral column, right to the aorta as well. Ascends all its way up behind the liver, posterior superior to the diaphragm, enters the diaphragm hiatus at the level of T8 vertebra, travels for a short distance in the thorax, enters the pericardium and drains into the right atrium posteriorly. In its process, it receives various tributaries from below upwards. At the level of L5 are the common iliacs, which conjoin and form the IVC. Then it receives the 4 pairs of lumbar veins on either side, the large renal veins on both sides, and very small inferior phrenic vein just under the diaphragm. The right gonadal vein and the right suprarenal vein also drain into the IVC. Whereas it is not so in the case of the left side. The left gonadal vein and the left suprarenal vein drain into the left renal vein. Then there are the hepatic veins, the right, middle and left hepatic veins posterior to the liver. They all piggyback and drain into the IVC. The blood from GIT is not drained by the IVC. The blood from the GIT, from the superior mesenteric, inferior mesenteric and the celiac supply, entire blood drains into the portal venous system. The portal vein enters into the liver. In the liver, it gets filtered, and the filtered blood is then sent to the hepatic veins, which drain into the IVC. The IVC is very safely nestled in the deepest portion of the abdomen. Most of the time, it doesn't get injured. Gunshot wounds, stab injuries do injure the IVC. Sadly, those people don't make it because of the torrential hemorrhage. Large thrombi from the iliac veins can get dislodged into the IVC. So IVC is the seat for filter placement called the green film filter to prevent embolism, pulmonary thromboemboli, septic emboli. The IVC also can get compressed by a variety of lesions, tumors, large cysts, malignancies, lymphomas, pregnancy. Advanced pregnancy state, the females are advised to lie down on the left side to reduce the compression on the IVC. The classical case of IVC migration is the thrombus migration into the IVC from the renal cell carcinoma. Nowadays operated deftly by the urologist. The other surgeries in which IVC is in question is the mesocaval shunt done for portal hypertension, as well as the atriocaval shunt done for complex liver surgeries and for liver trauma and for IVC trauma behind the hepatic veins. The IVC also has got minute communications with the hemiazygos system as well as in the chest to the azygos system. These open up only in case of obstruction to the IVC. Alternate channel from the IVC to the SVC is established. By this normally thin channels, they open up to divert the blood in case of slow, insidious, chronic obstruction of the IVC. Sudden obstruction of IVC or sudden clamping or ligature of the IVC is incompatible with life. Thank you for listening once again. You can always process your ups and downs and keep me posted so as to enthuse the interest in me. Thank you.